Hi, Dave Rhine here. This week I'd like to talk to you about an article that Rowan has posted concerning CTE. The article she posted is about Ty Pozzobon, who is a professional bull rider from Merritt, BC, not far from where I am right now. This is Kelowna and this is Mission Creek. Beautiful pathway along the creek for running and biking. And I ride it to work sometimes. That's what I'm doing today. Stopped to do this video. The question of the relationship of recurrent concussions or head injuries to CTE is an important question. Medicine doesn't have a clear answer to it yet. There seems to be a relationship, but cause and effect has not been proven. It's probably a multifactorial issue, meaning there's more than one thing that contributes to the development of CTE, and CTE still remains a post-mortem diagnosis. In other words, you can only diagnose it after death by looking at the brain itself. There are many brains that have been donated to brain labs in Boston and in Toronto that demonstrate CTE, and many of these are athletes. In research, this represents a selection bias, however, and also represents the numerator of the problem and not the denominator. We don't know how many people are actually out there in the community with CTE and are behaving normally and performing well and functioning at a high level. So it's a big question, a puzzling question. In my opinion, it's this number of subconcussive blows that you receive over the course of your athletic career or your life that are more likely to lead to or be a factor implicating the development of CTE in an individual. And that raises the question of what is a subconcussive blow, and we don't even have the answer to that. Concussions have been recorded with as low a force as 30 G, and forces greater than 300 Gs have been measured in professional athletes without causing a concussion. So there's a huge variability from person to person about what can cause a concussion. So again, in my opinion, and I'm not alone in this, I think that it's the subconcussive blows, the number that accumulate over time that are a factor. But there's genetics, lifestyle issues, mental health issues, multiple factors that contribute, and thus it's a multidisciplinary condition. Whatever, if the outcome is the death of a young, vital person, as in Ty's case, it's sad and it's unfortunate, and if we can find ways to reduce head injuries and thereby reduce the input or the effect that head injuries and subconcussive blows have on athletes, leading to this problem, then that's better for everyone. So use pace, get better, don't go back to play until you're recovered. Talk to you next week. Take care.